Hello and welcome to this training on supplements. We're going to give you a brief overview on some of the most popular supplements that we see or that we might recommend, and I'll tell you more as we kind of go along here today. The big reminder when we were talking about supplements is that supplements are meant to supplement a healthy diet. They are not meant to replace the nutrients that you should be getting through food. You cannot out supplement a bad diet. The foundation to overall health is actually eating regularly and getting in the nutrition and the variety. Supplements, I want us to think of like that icing on top of just that like double check of, am I getting in what I think I'm getting or what I need to be getting? So supplements are a later thing or a reminder thing of like they're needed, but they're not going to replace us eating a good balanced diet, a healthy diet. So what we're going to cover today, multivitamins, collagen, creatine, probiotics, antioxidants, fiber, magnesium, fish oil, all ones that we typically get asked about that we think that you should definitely be aware of. So first we want to cover with the multivitamin or multimineral. Multivitamins and multiminerals are generated and made to create and to meet the needs of the 98% of the healthy population. So RDI is recommended dietary intakes. It's supposed to meet that recommended dietary intakes for 98% of the healthy population based off of the USDA dietary guidelines for Americans. Typically, I like to recommend for people to look for a one-a-day multivitamin and to have it not be a gummy. Gummies technically and typically don't get all of the things that we need in them. Typically, gummies don't have a lot of the fat-soluble vitamins. They don't have a lot of those minerals. So I like to look for that one-a-day brand, or if it says one-a-day on there, that's a really great way. And especially if you're a woman, you want to look for the women's version of that because it has higher amounts of calcium. Calcium is specifically needed because we are at risk for osteoporosis, especially as we age and we go through perimenopause and menopause. So making sure that there's calcium in there, 1,200 milligrams a day is a recommendation. And then also making sure that there's iron in there too. If you are before or pre-menopause, before menopause, you want to aim and make sure that it has at least 18 grams of iron in it. If you are post-menopause, you want to look for the one-a-day women's 50 plus. It's going to have a lower amount of iron. You don't need that additional iron as we get older. It actually can cause increased health issues. So if you are through menopause, look at that one-a-day women's 50 plus to make sure that that has a more appropriate iron amount for us. We also want to make sure that these multivitamins are complete. That we're going to have all of the water soluble and the fat soluble vitamins. So the B vitamins and vitamin C, of course. So B vitamins, think like riboflavin, niacin, folic acid, biotin, pantothenic acid, B12, all of those we want in there. We want vitamin C, which is another water soluble vitamin, but we also want to make sure that there is the vitamins A, D, E, and K. Those are the fat soluble vitamins that get stored in our bodies. With water soluble vitamins, they don't get stored. You cannot reach a toxic level of those. But with the fat soluble vitamins, you want to get those in consistently to keep those stores up. You also want to make sure that you're getting in minerals. So you want it to have like the selenium, the copper, the zinc. Making sure that that's on the nutrition facts panel is a really great way to ensure that you're getting a multivitamin and a multimineral. Remember, taking a multivitamin or multimineral does not replace you choosing or having healthy options or healthy foods in your diet. This is more of like that icing on the cake, just to double check that you got everything that you need. Collagen. Now, collagen is one that's definitely gained increased popularity within the past 5 years or so. We're going to get collagen, especially that collagen powder, either from bovine skin ligaments or through fish skin ligaments or through chicken skin ligaments. Any of those are going to be those main sources of collagen for us. It is an incomplete protein, meaning it does not have all of the essential amino acids for us to sustain life. So you would not be able to survive on collagen powder alone as your primary source of protein intake. We're really wanting to make sure that we're getting other sources of protein that have all of those essential amino acids. Collagen is naturally found in our skin. We're going to have it there. It's going to help with promoting skin elasticity as well as joint or wound healing if you've had any sort of surgery or a cut. For skin, the benefits of the collagen are going to be decreased wrinkle formation, increased skin elasticity, increased hydration. We have to make sure that we're staying well hydrated, increased collagen content, density, and the synthesis of collagen too. So taking collagen can absolutely help with firming skin and reducing that wrinkle formation. For joints, it's also very highly recommended for joint health. The supplementation can help with increasing bone strength, density, and mass. It can also help to improve stiffness and mobility and then functionality, as well as reducing pain. So collagen, especially if you're using it for your joints, is going to be best prior to exercise, about 30 minutes or so, to help with reducing some of those issues while you're exercising. I recommend getting the collagen powder and mixing it into a water or another sort of beverage for better absorption. They do have pills, but they might not be absorbed as quickly or as best as possible. The recommended dose is going to be at least about 2.5 grams to maybe 10 grams a day total. And research shows that 2.5 grams can actually help with improving nail health overall. So just keep that in mind. If collagen is helpful, I like the Vital Proteins brand. It's pretty regularly available. And we'll talk more about what to look for to make sure something is reputable too. Creatine is another one that I've been increasingly asked about, and we see this more and more recommended for people that are in perimenopause and menopause. The primary reason and source for creatine is it's primarily used to help with recovery from exercise and exercise function. Our body can actually make half of the amount that we typically need, and then we get from our food that other 1 to 2 grams that we need. So overall, we need about 4 grams of creatine a day. We're going to be getting that from protein sources. You're going to get it because your body is making it through our own organs. Creatine does help with that quick burst of energy through exercise. Think if you're doing sprints, creatine can help with that. It's part of the energy component. So it's stored in our muscles with ATP. When we have creatine and ATP, they can attach together and they create more of that energy focus for us. So when we have those two things that are ready to go, it's going to be help for improved recovery, of course, but then also help with increased endurance as far as with exercise. The recommended dose is 4 to 5 grams daily, and it appears to be safe for up to about 18 months, but I would consider cycling off of creatine at times. Let's say you take it for 6 months on, go off of it for a month, because it can cause increased stress on the kidneys as well as the body. So you don't want to be on creatine forever. Another thing too to know about with creatine, if you do start to take it, because our bodies are storing it in our muscles, it's also going to be stored with water, which can actually cause weight fluctuation. So you might see a 3 to 5 pound weight gain. It's usually fluid changes because your body's holding on to that creatine. Once you stop to take the creatine, the fluid will come off. Antioxidant supplements, I was asked about these recently, and just something to kind of be aware for us. Spirulina is a big one, or greens or orange powders or red powders or those super beets. Typically, there are concentrated forms of antioxidants that can help with reducing oxidative stress in the body. Antioxidants are from colors, so we get them through the foods that we eat, the fruits, the vegetables, the whole grains. I think it's always going to be better to go through natural sources of those antioxidants first, like eating more, color on your plate, having more of those reds, blues, purples, greens, yellows, all of those oranges. That's the variety of antioxidants there that's going to be best. Typically with these, they're not regulated. They're not super mainstream where we don't really know what you're getting out of it. But oftentimes you're going to have, it's just going to be a vitamins A, D, E, and K, which all have upper limits, which means they are stored in the body. You can't have too much A, D, E, or K. And B vitamins and vitamin C are water soluble. Remember, we can take what we need and then we pee out the rest. So rather than taking an antioxidant supplement, I typically recommend to people just going ahead and eating a good balanced diet, making sure that you're getting in at least 5 servings of fruits and vegetables a day can help with getting in those antioxidants that you need and getting the color variety to help with reducing stress and inflammation in the body. Fiber. So what does fiber do? Well, it has 2 different jobs for us. It can either be a sweep or it can be a sponge. The sponge type fiber is called soluble fiber. When you add it to water, it starts to expand. It's going to soak up excess triglycerides, cholesterol, help to get them out of the body. It's water soluble. So it starts to dissolve in water. It creates a gel-like consistency. Think chia seeds. So definitely needed. It can help with creating more bulk to our stools. And then we have insoluble fiber, which is more like a sweep for the digestive system. So think of more of those like rougher things that we might be having. Beans, crunchy vegetables, cauliflower, broccoli, asparagus, Brussels sprouts, all of those are going to have more of that insoluble sweep type fiber. Sometimes when we're taking fiber supplements, you might see that it has inulin in it, which is a prebiotic fiber. That means that that's a type of fiber that feeds probiotics, which is the good bacteria in our stomach. Inulin is typically found in vegetable fruits, and it's also typically that fiber that's added to a fiber or high fiber product. So if you were going to go and get like the Fiber One bars, it's typically inulin that is added to those. Or we would have chicory root, which is highly and quick fermenting type of fiber, not a great type of fiber for us to have if you're someone who has GI issues. So if you get a lot of gas, bloating, loose stools, upset stomach, You really want to avoid chicory root if you're someone who's on a low FODMAP diet. Chicory root is not going to be your friend. It's a very high and fast fermenting fiber. We want to kind of stay away from that. Metamucil is often another fiber supplement. That is a soluble fiber. So it's going to be better for that blood sugar control, better for fullness, but it's not going to have the intended effect of helping with constipation. So remember, soluble fiber expands in water, helps to fill up your stomach, help you to stay feeling fuller for longer, slowing down digestion. Not going to be helpful if you're feeling constipated. Fiber gummies, I typically don't recommend those because we don't know exactly how much you're getting out of them unless they are USP or NSF certified. Most often they're going to be soluble fiber in there. It's not going to be a soup type fiber. So just try to keep that in mind. Probably not the type of fiber that you're looking for. Better to get more of those whole grains, fruits, and vegetables. An important reminder is anytime that we increase fiber, we need to increase hydration because with increased fiber, you are at increased risk for constipation. We have to increase water to prevent that constipation. So anytime that you're saying, all right, I'm getting 12 grams of fiber now, I'm going to get 20 grams of fiber, increase your water or else you will be constipated. Remember, any of the whole grains, fruits, vegetables, any plant products, that's where we're going to find the fiber. So fiber is found in the cell wall of those, so it can help. It's not digested in our body. It's going to do those two jobs. So making sure that we're getting more plant products in our day can help you to increase that natural fiber supplementation or fiber intake naturally. Probiotics, they go with fiber because probiotics are typically found over the counter and they are what, think of like that good gut bacteria. You might hear the word microbiome. We have to think that we've got a whole other world inside of our GI tract. We have to make sure that world is populated through by taking probiotics or having probiotics naturally through our diet. The gut is a very, very harsh environment. If we're not naturally getting in probiotic intake, we can cause some imbalances. We can cause genes to be turned on and turned off, which are more harmful for us versus helpful. It can also cause mental health issues, struggles, and so much more. So trying to get probiotics in daily is very important. We want to find a broad spectrum probiotic that's going to have at least 4 to 6 different strains in there. There are different strands of probiotics, different strains, lactobacillus, bacillus coagulans, there's a whole bunch of different ones because we have to remember that everyone's microbiome is going to be different. Your microbiome is different from mine, and it's going to have a different population of those different gut types. We have to have those daily, remember, because the gut is such a harsh environment. And we can also get some of these probiotics through food. So looking for things like yogurt, all yogurt, because it's fermented, will have probiotics in it. Same thing too with kefir, sauerkraut, kimchi, some of the fermented pickles. All of those will have that good gut bacteria for us. I like to eat sauerkraut while I'm making dinner. It can be a just easy way for me to get some of those probiotics in if I'm not feeling yogurt. We also need those prebiotics to help make sure that those probiotics are thriving. Think prebiotics are the food for the probiotics, and that's fiber. So go back to that last slide and just look through that. Remember, I need more fiber intake. It's going to help with that. And then lastly, with probiotics, we want to make sure that they're having at least 4 billion CFUs, which is colony forming units, to make sure that we're getting enough because they're not all going to survive when we have them to when they get to our stomach. We want to make sure that we're getting as much as we can in to increase the chances of them surviving. Magnesium, this is another common one that you see. Most people are actually deficient in magnesium. We don't eat enough sources of magnesium, which I don't have it on here, but I can list those for you. There are different types of magnesium. You want to make sure you're taking the right type. So magnesium citrate is a natural laxative. It can help with reducing inflammation, but if you're taking magnesium citrate, you're going to be in the bathroom more often. So if you're constipated, that can help, but not the best if you are magnesium deficient. Magnesium oxide is not very absorbable, but can help with indigestion if you're having any of those issues. Magnesium L-threonate, it helps to pass that blood-brain barrier. It can help with sleep. It can help with digestion, cognition, and memory. So that's another good one to be taking. You can take a magnesium glycinate or magnesium L-threonate. You'd have to go online to find these. They typically don't carry L-threonate in the grocery store, but definitely can be helpful with chemical imbalances in the brain. Glycinate is very absorbable because it's magnesium paired with an amino acid glycinate. It has more of those calming properties. It's going to support better hormones, sleep, and recovery. So I highly recommend that. Or you could do magnesium malate. It's highly absorbable as well. It's going to help with delayed onset muscle soreness or pain from exercise. The recommended dose is going to be 300 to 400 milligrams a day. And the best sources of magnesium are going to be pumpkin seeds, dark chocolate, avocado, bananas, seeds, and nuts. Those are going to be the best sources of magnesium for us to get them in through a natural source. So always start there before adding in that supplementation. Fish oil is another really great one, especially if you're a woman who's going through perimenopause or menopause. It with the hormonal changes, we do tend to have that increased risk of just issues going on, blood pressure, heart issues, increase in heart disease. So the recommendation for fish oil is at least 1,000 milligrams a day is going to be that recommendation. This is going to help with lowering blood pressure levels, managing triglyceride and cholesterol levels as well in the body too. Some of the best sources are going to be fish or seafood, seeds and nuts, as well as some of those oils. We want to make sure that they are liquid at room temperature. Avocado oil is going to be a great option. Same thing too with olive oil, another great healthy option for us. In the supplement form, you want to make sure it's a high quality fish oil. I know people like the Nordic Naturals version of it, so it doesn't have that fishy taste or smell. Omega 3s is going to be pretty much the same. Same thing too with CoQ10. So all of those are going to be pretty much the same. You can get a vegan form of like an omega 3 through like a kelp oil, or just get it through food sources, fish, seafood, nuts, seeds, oils. And lastly, the one thing to look for when you are taking any form of supplements is checking in to see if it's been third party tested. This is an independent lab, NSF, that will pull products in and test them and say, like, all right, if you say what you say is on here and in the right amounts, you can get this. If companies have been third party tested, they will proudly display that badge of honor because they're saying that we've gone the extra mile to ensure that you're getting what we say that you are getting. You really want to look for this. Another one is the USP verified. It just says USP on it. So either of those are going to be meaning that they've been third party tested and approved for what you are getting is actually what it says you are getting and in those appropriate amounts. If they don't have those, because supplements are not regulated, you might be getting more or less than what you think you are getting too. So I hope this helps with understanding some of the supplements, what you need to know, what you need to be aware of, and what we recommend. If you have any questions on this, just send us a message. Hope you have a wonderful rest of your day. Thanks for watching.